these are difficult issues, and I think, as I told to some of the folks in the panel, those of us who are pro-life and vote that way, who have served many, many years, we're saddened that these things still occur in our country. On Tuesday, I did a press conference tour of my district outside 3 Planned Parenthood clinics. Tuesday, one was closed, wasn't even open. So I want to talk about the access to care issue a little bit. But before I do this, some of this moral outrage, and one of the benefits of being a member for a long time is you have the benefit of history. And we had a hearing when Republicans were in the minority on secret videos taken in a meatpacking plant. Down cows. There was more outrage over the treatment of down cows than we have of treatment of down kids, babies. And there was no objection to the videos being presented. In fact, they didn't even call the video people to the hearing. So it's just unfortunate that, again, I do think there's a double standard. And also I want to mention the healthcare aspects. The other thing I did in Illinois, why I went to them is because federally qualified healthcare clinics in Illinois, we have 670 better alternatives for women's health care and only 18 Planned Parenthood locations. So this debate about our ability to affect women's health care, in fact, by these bills that we're going to move through the House, we're going to be able to provide better care because Planned Parenthood clinics don't provide all the range of health care. I'm not a supporter of the Affordable Care Act. I didn't vote for it. I don't believe in it. I think it was terrible. But the premise of the Affordable Care Act was medical homes. For people to go to have a medical home and a medical location for records. Guess where your medical home is? It's not in a Planned Parenthood clinic. Your medical home is found in a federally qualified health care clinic. So we're on the right track if we move this debate to improving access to health care, expanding federally qualified health care clinics, rural clinics in my case. I'm in Southern Illinois. 3 Planned Parenthood versus 40 accesses to rural care or community health clinics. Mr. Mannix, the question I have, going back to the videos, do you believe these videos actually depict Planned Parenthood's practices?
I believe, first of all, you actually have a letter from Cecile Richards, which I assume is an unedited letter from Cecile Richards, in which she actually says that Planned Parenthood is receiving $60 per part. At no point in that letter does she also say how they are actually accounting for that, how that applies in some way to any actual expenses. And remember that STEM Express, at least, is actually coming into the clinic. I have often seen the citations to, well, these are situations where, this is compensating for transportation or storage. Well, it's not compensating for transportation or storage in those cases. But the full versions, and that's outside of the videos, the full versions of these videos, let's be absolutely clear. If you have access to YouTube, you have access to the full versions of these videos. They are on YouTube. I know that because I've watched the full versions of the videos. They are there. As a matter of fact, without music. So you can watch the full versions of the videos. The only portions of those videos that have been edited out are the portions when Mr. DeLayden or someone is in the bathroom, and I think we can all be grateful that he edited those portions out, and the portions where no one else is in the conversation, where it's him sitting alone or otherwise. So the full versions are available.
And follow up, do you think states should be able to take action on these videos?
Absolutely. The Guzman case in the Ninth Circuit indicates that states do not have to wait when they have reasonable belief that the law has been violated. They can suspend a Medicaid provider without having to have that person convicted by a jury.
Thank you. And I'm just going to finish by, obviously there's a list of services provided under federally qualified health care clinics versus those services provided by Planned Parenthood. the services provided by federally health care clinics, family homes, far outweigh anything provided at the Planned Parenthood clinics, and I yield back my time.